Welcome back to another episode of The Biz and the Bees. Today we have a guest who is at the fascinating intersection of medicine, technology, and business leadership. Dr. Mary is an accomplished orthopedic surgeon and the chief medical officer at VoriHealth, a company that is fundamentally reimagining how we treat muscle and joint pain in America through a virtual first holistic approach. We're going to be talking about the challenges of innovating in healthcare, what it takes to build a new model of patient care from the ground up, and the future of health tech. Dr. Mary, it's an honor to have you on the show. Thanks for being here.
Philip, my pleasure. Thank you so much for having me.
Why don't we start with a brief intro? Tell us a little bit. I have a little bit of background information on you, but tell us a little bit more about you and how you arrived at where you are, just at a career level.
Mm. Well, I'm an orthopedic surgeon by background, and I trained at Mayo Clinic, and I went on staff at Mayo Clinic, Florida, and I was in the Mayo Clinic system for a couple decades, and lots of leadership roles at Mayo. I love Mayo Clinic. I was chair of the orthopedic department in Florida, and leadership roles in Florida campus, and also enterprise-wide across the Mayo system. I retired from Mayo in 2015 when I was recruited to Yale to build an integrated musculoskeletal center. And I worked on that for a little over 5 years, and then just had the opportunity to co-found VoriHealth. And I decided to take the big leap from the comfort and security of academia to entrepreneurship because I realized that the fundamental changes that we needed to make in the healthcare system, particularly around orthopedic and spine care, we weren't going to be able to make in the traditional system. The barrier, and that's one of the fundamental problems, right, with healthcare today. So that's really why I decided to, go on pursue this new journey, for which I remain very excited about what we're building.
That's awesome. Well, as you mentioned, you had a distinguished career. Now that you're the CMO at Vori and you've embarked on this new adventure, and it seems to be a very different path than traditional medicine. Let's start with the fundamentals of why. Why, from your clinical experience, what was so broken or frustrating about the traditional model that you felt
Yeah.
Vori Health absolutely needed to be created and go through the pains of growing that business out?
Yeah. So one of the fundamental problems with the traditional healthcare system in the US, and I think it's important, Philip, that we recognize that there's not evil people running our hospitals and healthcare systems. These are the systems are trapped um, in a downward spiral linked to how hospitals and health systems and medical providers are paid. Okay, I'll make it real simple. All hospitals generate their financial margin off of limited activities, meaning they generate it on elective surgery, advanced imaging like MRIs, and procedures.
Okay.
Every hospital loses money on a pediatric service line or
Hmm.
an OB service line. That's why you see all these hospitals, particularly in rural America, that are closing obstetrical services. Like, well,
Okay.
I don't know, where are these women supposed to go? Right. But that's a
Right.
whole separate story. So, but you would say, well, why? Because the financial margin is generated by elective surgeries, imaging, advanced procedures. So if you say, oh my goodness, we're doing a lot of inappropriate and unnecessary surgery, and we're doing inappropriate MRIs that then often lead to surgery, and you introduce a model that's going to decrease the rate of inappropriate events occurring, what
Okay.
happens is you lower the opportunity for generating the margin for hospitals and healthcare systems, a margin that they need to exist to subsidize the service lines like pediatrics, OB, infectious diseases that will never be cost neutral. That's because
Yeah.
the
Sure.
system is so fundamentally complex and messed up. So it's not that healthcare systems don't want to innovate. they're caught in the classic, Clay Christensen's innovator's dilemma, where they can't innovate because in order to innovate, it would compromise their ability to financially keep the doors open. So, hence the need to say, all right, I'm going to go outside the system. I'm going to embark on this, adventure to create this nationwide musculoskeletal telemedicine practice so that we can deliver more holistic, patient centered care. One, to give the patients a better experience because we coordinate care so much better, it's less fragmented. And two, to help drive down inappropriate things that ultimately often cost patients not just money in terms of like out of pocket costs, but expose them to surgical risk and surgical complications from a surgery that they never really needed in the first place.
So by reducing that overhead and sort of the loss leader pieces of that, you're able to really focus on the core of the problem that they're trying to solve.
Yeah, our goal is to help our patients get better without an operation.
Nice.
We recognize that some people still need surgery. And I mean, I'm a surgeon. I know this, okay? My co-founder is a spine surgeon. He knows this. So some people still need surgery. We're not anti-surgery. We're just anti-inappropriate surgery. And so we refer patients, our docs do, who need to see a surgeon to a surgeon. We refer them to get an MRI if we need them to get an MRI. But we don't order MRIs on every patient that has back pain because that's not actually evidence-based medicine.
Gotcha. That makes a lot of sense. I didn't realize that it was quite that a big a disparity in where the actual profit margins in the centers where cost centers were. That's interesting information for me. I'm
It's
obviously not
it's
in that
actually
field, so that's I think a lot of people wouldn't necessarily know that.
well, it's kind of like a dirty secret in medicine, right? Because, uh, that is the reality. And so if you go into a healthcare system and you say, "I'm gonna help you deliver better care to the patients that you serve," and part of that means we're gonna lower the rate of inappropriate surgeries. Like,
It's probably met with
"Whoa,"
some resistance, I would imagine.
right?
Yeah.
And I don't know one hospital administrator over a surgical department whose key metric is not surgical volume, right? They wanna know how many surgeries are the surgeons at that hospital doing this year? How many more can they do next year? So the metric is number of surgical cases. And why is that so important? Because that's where so much of the profit margin is generated for the hospital. So again, I don't think the hospital people are evil in any way, right? I don't think they want people to get inappropriate surgeries, but they'd rather just not acknowledge that, there is still a significant rate of inappropriate surgeries that happen, unfortunately, in this country. And the surgeons, and I need to put a little caveat on that. I'm
Sure.
a surgeon, right? The surgeons aren't like going out and saying to their patients, "Oh, I'm going to offer you this surgery, and I know it's not appropriate." Okay,
Right.
that's not happening. My surgical colleagues they're trying to help their patients get better. But where is the disconnect? The disconnect is sometimes those patients have not had good, adequate non-surgical care to begin with, number one. And secondly, sometimes patients will come in and they're looking for the quick fix, right? Just fix me up. If an operation can make me make me better, I
I don't
want
wanna
the
do the work, right?
operation.
I don't wanna
I
do the
don't want to
work,
do the
so
work. I don't want
let
to
me
lose the weight. I don't want to lose the weight. I don't want to increase my level of physical activity. I don't want to get healthier. I don't want to, watch what I eat, which would be an anti-inflammatory diet. I don't want to do those things. Just give me the surgery. But at the end of the day, that is still not the right answer because you still need to address these other factors that led you down this to be in a situation where, surgery was an option.
Yeah, and I think keeping it as an option is to your point, it's very important because there are very valid there's a time and a place for it. But not everything
Yeah.
is a nail just because you have a hammer, right?
Well, and remember, surgeons are surgeons.
That's right.
And the old surgeon adage, a chance to cut is a chance to cure,
There you go. I like that. I
right?
like that.
Right? I mean,
So,
and surgeons should be really good at surgery, right? And they are, but today most this will be a very fair and true statement. Orthopedic surgeons and spine neurosurgeons are not adequately trained in non-surgical care.
uh,
So, yeah.
they're specialized in a specialty, and there's probably to some extent there's so much to know. It's hard to be general or have other capacity to have other options. Even I could see that being an area of difficulty, right? It's the I this is such a vast field and it requires so much of me to know and stay up to date on this that even branching out a little bit to know there are other options can be difficult, I would imagine. So having other team members probably in the model that you're kind of building, having a team so everybody has an opinion is probably a, a different, very much a paradigm shifting sort of mentality, and then conceding to somebody else who has a differing opinion or a different option probably is a little maybe difficult for a surgeon who is a surgeon or any people in general, I would say. It's hard maybe to listen sometimes
It's hard,
to other opinions.
hard to categorize, but particularly for orthopedics and spine, part of the other gap issue is that most primary care physicians are not well educated, not well trained on orthopedics and spine. They don't get very much in medical school. They don't get very much in their residency training program. And they're so focused, God bless them, on diabetes, hypertension, heart disease, all these other things that they have to manage for their patient. So there's a knowledge gap on the primary care physician side, and then the patients they refer the patient, they get the MRI, then they send the patient to the surgeon. So there's this gap in a doctor who can deliver and guide expert non-surgical care, and that's the gap that we fill. So
Yeah,
we
so
have
let's
physicians
oh, sorry, go ahead.
no, we have physicians who are experts in non-surgical orthopedic and spine care. We have physical therapists, we have exercise physiologists, health coaches, registered dietitians, and so that's kind of the main clinical types that we have, and we have a very innovative model where for patients with more complex conditions, they see and they have their first visit is what we call our integrated visit, where on the video visit is both the physician and the physical therapist together with the patient.
Okay.
Wow. Okay. Now, why does that matter? That matters because the physician is there to render the medical diagnosis. The physical therapist is there to render the functional diagnosis. The patient can tell one story. Both clinicians are hearing the same story, getting the same information, asking questions. There's one physical exam done through the video, and then a care plan is developed. So instantaneously, we have alignment of the two clinicians, the doc and the physical therapist,
Mhm.
which which doesn't often happen
Well, you're not playing
in terms
telephone,
of
right?
there's
The old game of
there's
telephone.
very
I say something, you say something, and by the time it gets to the third or fourth person, it's not what was intended at the beginning. So I like that. I like this notion that you're creating that alignment from the jump.
we surveyed our patients and published a research study on this, and we had very high levels of patient satisfaction, and hardly any of them had ever experienced anything like this before. We just had a few people, and that had been in the hospital setting. And what really, I guess, pleased me the most about the study was that, we had 93, 94% of patients saying that they felt that that the format of this visit helped them understand their condition better and how to treat it. And I was like, whoa,
That's cool.
okay. Now that's powerful, right? Because if we can help patients improve what we call their health literacy, then 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 we're going to enable them to participate more effectively in their care plan, because medicine has to be less paternalistic and more of a partnership. I can tell you all day long, Philip, what you should do, but if you don't do it, right, nothing's going to happen.
And we know from just psychology in general, the best way to get a kid to do something you don't want them to do is to tell them they can't do it. And if you take that and apply it to adults as well, because we're the same way, tell me I can't do something and watch what I do. So
Exactly.
I think I heard a powerful talk not long ago at a retreat I was at, and it talked about don't give advice, tell I stories. And the idea was, I'm not going to tell you, Dr. Mary, how to do something. I'm just going to tell you a story that I think relates to the thing that you're dealing with. And I'm going to offer something that I experienced and I saw. And that I story really allows for you then to pick up what's important and it helps gives you some context and it becomes me telling you without telling you directly what to do. It's just I'm sharing an experience and in an I format, and it is a powerful way to have a conversation. I've found. So
Philip, what you're referring to is you're speaking to the need to make the emotional connection,
mm,
right? When you're telling that story, the person who's listening to the story, it resonates with them if they've made some type of emotional connection to the story, right? And we have to do a better job of that in medicine as well. So so part of our focus is we want to know what matters to our patients, not just what is the matter with them.
mhm, there you
So
go.
if you right? Because if you come to us for back pain, we see lots of patients with back pain. Why? Because so many people have back pain, right?
Mhm.
So, okay, we're here to help you get your back pain better, but we want to know why that matters to you. Does it matter to you because you want to go play with your grandchild or you want to run a 5K? And so now our care plan is focused on how we can get you back to that activity that
Mhm.
gives you joy, that enriches your life. It's not just your back pain getting better, right? It's you being able to run that 5K or play with your grandchild.
Yeah,
'Cause that's
it's
that's what matters to you.
it's really a side effect. The back pain being better is a side effect of this other goal you have.
Exactly.
Yeah, I love it.
Yes.
So you've outlined a very powerful mission that you guys are working on. This holistic, non-operative model, or at least not operative first, right?
Yes.
Or operative only. But innovating in healthcare is incredibly complex. As you guys have worked to scale this virtual first approach, what's been the most unexpected challenge or point of friction that you've dealt with? And then sort of a secondary question while you're thinking about that is it in changing behavior of patients? Is it aligning with insurance partners? Is it, to your point, some of the billing and funding aspects of it? Or maybe it's just on coordinating with your own individual teams, who are all in remote locations. Like, what's been that surprising friction that you've run into?
Well, this is my first, startup company, and I'm certainly, not an expert in all the areas that need to be brought in when you're starting a company. But probably one of the things that has surprised me is the challenge of outreach to members and the cost of converting a member to a patient. It's the cost of acquiring that member.
Okay.
And so this is it works different for different partners of ours, different clients, because obviously if we can outreach to their members directly, because now we're a covered benefit for them, that's great. Okay. But even in that context, what has surprised me is how terrible the email data is for members in these insurance carriers
Uh,
or self-insured employers. So primarily we work with self-insured employers and more, I'll call more enlightened insurance companies who recognize that there needs to be a new model in terms of how we can provide care to orthopedic and spine patients. And they're looking for ways to lower rising healthcare costs while still providing care that members need. So you would think if I'm an insurance company that I would have an accurate email address on you.
oh,
Like,
yeah,
okay? And it's shocking to me how what a high percentage of them, I won't give you any names or numbers,
sure.
um, how
ABC,
how
XYZ. Gotcha.
how few how few of them have accurate emails on the majority of their members. That was just shocking to me.
Okay, so you've got a data problem. Um, are you guys, when you guys find that situation, do you have an opportunity to help them clean that data up and enrich and build that back out? Are you giving them advice on maybe how to do that because you guys are more of a digital based entity and more of a startup mentality? Do you find
Well, we
opportunities to
have
advise them on how to do that and clean that up?
well, Philip, I would say that, we're still a startup and the resources that we have compared to one of the huge insurance companies is,
Okay,
a little different. Okay.
sure.
But we have other ways of reaching out to their members to say, hey, we're here now, we're a covered benefit. And so that's, we have alternatives to just reaching out through email. There are, mailers that you can send in the mail, etc. But when you ask me what surprised me, I would say that surprised me.
Yeah. We've got a couple of some clients of Ripple, the company I own. We have some surprising it's not surprising to me that there are data holes and data issues. Like, that's not a shock to hear you say, "Oh, by the way, we don't have a good phone number," or "We don't have a good spelling of the first name," because somebody somewhere put it in, whether that was the patient themselves or whether it was an intake form, and I know personally, if you were to look at any of my handwriting, it's terrible, so the likelihood of somebody spelling my name incorrectly with 2 L's is high. It's interesting that that's the thing, but I can see it. I can see that as being a challenge for you. So with that being said, as you guys look into the future, and as you're moving through your startup phases, right? The potential for this model is certainly large. There's a I think our pandemic that we've went through has shuttered a lot of public people, even in my industry, we're still not traveling like we used to. Not for that reason necessarily, but we got where we didn't have to. I know that recently, we have used virtual visits more and more frequently for doctors. Even I have a cold, or I don't feel good, or that's becoming more and more of a thing for us. So as you guys kind of work through that, next 12 to 18 months, what do you guys see as the single biggest hurdle for VoriHealth that you guys need to overcome to reach the next level of scale and impact? Is that a technology problem, a talent acquisition problem, or something
Mm.
else entirely?
I think we just have to keep firing on all cylinders and pushing, you know, the the tweaks that
Mm,
we discover, right? I don't think there's any, like major area. There's always things that, we're looking to improve.
mhm,
How can we better improve the patient experience? Is there a is there a different tech option that's going to be easier for seniors
mhm.
to use to engage with us,
Yeah,
right? Um, Although, of course, seniors are not seniors. A lot of seniors have spent years on a computer. Like the
it's getting
Medicare.
better.
Yeah. So
It's getting better.
when I say the Medicare patient who's tech savvy, there's a lot of them, right? Now,
Mhm,
when you're going to look at somebody who's maybe 80, 85, 90, that's different. And
Gotcha.
those individuals need more tech support from us. And it would be, you know, if I could have a magic button and just, if I was queen of the universe and I could fix one thing for us right now, it would be that there would be no tech issues for any patients, especially seniors.
I got you on that one. Still to this day that I have a grandmother who anytime Netflix doesn't load immediately, like I'm driving over to deal with that. So I get it. I understand that. And it's one of those areas where I think generationally, 5 or 10 years from now, it'll be far less of an issue. But we are in this weird transition. And even now with like AI coming online, there's a whole body of that's going to create a whole nother lag for sort of that adoption and that acceptance and the utilization of it. So I think it's interesting how technology moves us along. So um are there any other parting sort of thoughts or things you'd like to share that we didn't cover? Any topics of interest or passion that you have that you'd like to share with the audience?
Well, I would just suggest that if anybody in the audience is interested in our model and what we do, please reach out to me. Our we have a lot of self-insured employers, and I've also mentioned, insurance companies now, big name insurance companies that are interested in using us and are using us because they recognize that that innovation is needed in order to do the things that we need to do, right? And it's, because Philip, it's not just their costs that are impacted. If you look at out of pocket costs for families, even with employer sponsored insurance, like, wow, I don't know, I don't know how the average working family does it.
Yeah, I agree, and that's certainly a challenge. We have 6 kids at home, so we have no trouble hitting our deductibles. So every year we we hit our family deductible with no issue at all with all those kids around. So but it
Yeah.
is an incredibly expensive thing and necessary. Like it's you don't you just it's hard to go through life without that. So
I know.
we'd certainly appreciate you and your team building out a new platform and taking the initiative to look for new and innovative ways, taking advantage of tech, and certainly things that are at our disposal to make an impact on people's lives in the real way that you're doing it. So we appreciate that.
Thank you,
Um,
Philip. We're all about, staying centered on the patient and helping them with their journey.
that's awesome. So for people that do want to get in touch with you or VoriHealth, where should they go? What's the best way to reach out and get in touch with your team?
They can just email me, my name, Mary, Mary dot O'Connor, Oconnor, at Vori Health, V as in victory, ORI health.com.
Awesome. And we'll add some links into the post when we post these up. Dr. Mary, I genuinely appreciate the opportunity to meet and get to know you a little bit better, to hear about the mission that you guys have at Vori and the good work you're doing over there. So look forward to staying in touch with you. And for all of you guys listening on the Biz and the Bees, we'll see you next time.